Bien, pues ahora voy a platicar con otro de los profesores que están participando en este congreso, el Foro Venoso Mexicano, y me refiero al doctor Makis Avgerinos, un profesor eminente que pues, ha tenido participación importante durante los trabajos académicos de este congreso. Dr. Makis, nice to meet you. Welcome to Mexico. Tell us what is happening here about your lectures, the Congress, your point of view about it.
So first of all, I need to thank the organizing committee for inviting me. This is a wonderful meeting. It's my first time in Guadalajara. I enjoy the meeting, but I also enjoy your city.
Okay.
So I come from Greece, but for the past 12, 13 years, I have been actually practicing in the United States, in Pittsburgh. And I grew up by learning, by experience and by research on how to manage deep venous diseases. For many years, when we were talking about deep venous diseases like blood clots, acute DVT, or post-thrombotic syndrome, chronic venous obstruction, pelvic disease, for many years we have only been using blood thinners, anticoagulation. However, we now have enough experience to tell that our patients can benefit from new technologies. So when you have a young patient with blood clots at the iliofemoral segment, we can now go in with a single puncture behind the leg and aspirate the clot out in a single session. The patient will go home the next day and will give this patient immediate relief from leg pain, leg swelling. The quality of life will be so much better. And we're also providing a better long-term outcome, because if we don't remove the clot turns to scar.
Exactly.
And the patient develops what we call post-thrombotic syndrome. Constant heaviness, constant swelling, ulcers. So we can prevent that by aspirating the clot in the acute setting.
In terms of the prevalence of this type of diseases, we know that it's very, very high.
It is.
It's very common.
It is, and it actually becomes higher and higher. Over the past couple decades, we've seen a tremendous increase in DVTs. The population is aging. We are doing more and more surgical procedures, and surgical procedures are a reason for somebody to develop blood clots. Cancer is also increasing. Malignancies are also a reason for patients to develop blood clots. Plus, we now have the technology to identify blood clots, technology that we didn't have in the past.
Exactly.
So we'll be seeing more and more patients, and now it's the challenge for us to start offering a lot more than just anticoagulation.
Yes, and now you need another type of sources of technology to try to help these patients. And now, tell me something about, because you have two different points of view. One of this point of view, you're learning at the United States, you work there. You have another point of view from Greece, and another point of view now in Mexico. What is your opinion of these 3 points? Because the disease is the same.
Right.
But what about the technology, the treatments, the diagnosis?
So technology is universal, and to be honest, everybody knows on the technologies that we now have available. Now the difference has to do with the resources and the finances. So while working in the States, I felt I can have whatever I want, whenever I want.
Exactly.
Now, moving back to Europe and specifically to Greece, I feel I'm closer to what you have here in Mexico. So we don't have limitless resources. So what I see, not all hospitals have the capacity to use all the expensive toys that we surgeons are using to help these patients. So there are selected hospitals, typically academic hospitals, that do have access to these type of procedures in Greece. So I'm fortunate enough to work in a practice that I do have access in these devices, and I'm happy to see that even your colleagues have access in these devices. Not limitless,
Exactly.
not limitless, but still
Agree.
we can help these patients.
And the patients are different, but the disease is the same. And I think, and frequently I'm talking with my students, that the enthusiasm and the proud of the doctors is the same. No?
True.
No depending at all from the tools of the technology.
let me tell you something else also. To be honest, for a device that is very expensive, it doesn't necessarily need that is actually the best device available.
Exactly.
So now we have experience and we can use cheaper devices and still have good outcomes.
Perfect. Okay. So a final message from my audience, to my audience of Angio TV. A final message from you?
I enjoyed your country.
Okay.
Please follow your podcast or
Angio TV.
Angio TV, because it seems people can learn a lot.
Exactly. Thank you very much to be here, to stay with us today.
It was a
and
pleasure.
Congratulations.
And an honor.
Enjoy your first time in Mexico. Thank you very much. Pues él es el doctor Makis, que está participando aquí en el Foro Venoso Mexicano, y como ya pudieron ustedes escuchar, nos narra de todas las tecnologías, las alternativas terapéuticas que existen ahora para las insuficiencias venosas profundas, para todo este problema, y pues trabajando en Pittsburgh, en Grecia, y ahora aquí en este cuerpo colegiado, participación en este foro académico. Así es que continúen con nosotros damos cuenta de lo que pasa aquí en este Congreso Guadalajara 2024 del Foro Venoso Mexicano. Aquí seguimos.